Hello, everyone, and welcome to AAKP's Policy Summit, Patient Voice, Patient Choice, New Determinants for Kidney Policy. I'm Richard Knight, Immediate Past President of the AAKP. On a personal basis, I'm a former dialysis patient and 16 years out on my kidney transplant. Professionally, I work as an adjunct professor teaching courses in management and business strategy. Much of my background is in the public policy arena, working at congressional operations based on my experience on Capitol Hill, where I served in various roles, including communication, policy, and as a legislative director. While working in the U.S. House of Representatives as a top aide to a congressional leader, I had the privilege to serve as liaison to the Congressional Black Caucus and was involved in significant policy work with the House Energy and Commerce and Small Business Committees. These experiences have provided me with a framework and a background with a valuable set of skills that I've put to use for AAKP on kidney policy issues over the past decade. However, you do not need to be a professional policy expert to get involved in the policy process. You simply need to be an informed patient. Take the time to study important issues that affect you and your fellow patients, and take advantage of AAKP's free online advocacy engagement skill development training programs. Your voice and your vote can lead to important changes. If you are not a member of AAKP, please join us. Our membership is free. Just go to the link shown at the bottom of the page and sign up today. Furthermore, I want to encourage you to sign up for AAKP's alerts to AAKP's Action Center at the website that's now showing at the bottom of your screen. AAKP will keep you up to date about latest policy issues that affect patient care, and with one click, you will be able to contact your state representative, federal agency leaders, and many more who need to hear your perspective and your unique patient insights. Now, I'd like to introduce our session titled Vital Signals, Kidney Stakeholder Policy Priorities Impacting Patients. We're honored to have 4 individuals who are joining us who represent various organizations that work alongside the kidney community and other disease communities on important policy issues. AAKP is very interested in their perspectives and their views on issues of mutual concern. I'd like to now welcome another good friend and ally of AAKP's, Patricia D'Antonio, Vice President of Professional Affairs with the Gerontological Society of America. Patricia is joining us today representing the Patient Access to Pain Relief Coalition. In 2015, AAKP was a founding member of the PAPR Coalition, and AAKP's Paul Conway served as chair for the first 6 years and remains on PAPR's board. PAPR is an alliance of over 20 medical professional and patient organizations in the pain management policy space. The organization works to educate patients and professionals on safe use of pain medications, and most importantly, PAPR works to ensure your ongoing access to safe, over-the-counter pain medications that are compatible with your doctor's care plan for you and your long-term kidney health. Tricia, the floor is yours.
Thank you so much for inviting me today to participate in the AAKP policy meeting. It's always a pleasure to be here with you, and this year is nothing different, to represent the Protecting Access to Pain Relief Coalition. We have been able to meet in person, and we've been able to meet online, and again, I think this meeting is a great convening for all of us to learn more about how we can participate in the policy process. So let me tell you a little bit about the coalition that I'm representing here today. The Protecting Access to Pain Relief Coalition advocates for public policy to support continued access to and choice of over-the-counter or OTC pain relief medications. And we started almost 8 years ago now, related to an announcement from the FDA where they planned to limit access to over-the-counter acetaminophen. The coalition officially launched in 2015, and we have 22 members. I'm happy to say AAKP is well represented as part of the coalition. So our coalition, we have a board of directors, we have our policy and patient insight council, and then we have our members. And AAKP is represented on our board of directors, represented ably by Paul Conway, who is a great policy person to work with. And I think what's really important here is that understanding that our membership is across different types of organizations. Our members are working directly with patients and advocating for patients. Our members are working specifically in a variety of different areas. So some may be working in aging organizations, some may be working directly for kidney patients, some are working for chronic pain patients. So it's a really robust organization, and it's such a pleasure to be able to work with so many colleagues who are striving to ensure access to over-the-counter pain relief. The last time I spoke with you, we talked a little bit about the coalition structure. Since we spoke last, we have actually formalized our coalition, and we have become a 501c4 organization. So we really have started to establish ourselves much more than a group who have come together of different organizations who want to advocate on this issue, in that we've formalized our structure, we've formalized our governance and our operations, and this gives us opportunity to seek funding differently than we have in the past to support how we can continue to educate people about over-the-counter pain relief and the importance of access to over-the-counter pain relief. We continue to be supported by Holland & Knight, who manage our administrative functions. They are a law firm here in the District of Columbia, and they have offices around the country. But we work specifically with a team there for our administrative functions. And we currently have support from Johnson & Johnson Services Incorporated for those administrative costs. And here you can see our membership is broad. So you're not surprised to see, hopefully, the number of organizations representing kidney patients, including AAKP. Also, think about it. We have members here who are Transplant First Academy, Renal Physicians Association. So it's across the ecosystem of those who work with kidney patients. We also have members who work in oral health. And when you think about it, pain management and oral health is so important, and so important that we have access to over-the-counter pain relief when we have that toothache that's really bothering us, right? And then we see members who are from a variety of pain organizations. Now, some represent patients, right? So we have U.S. Pain Foundation, we have the Western Pain Society. We also have practitioners, the American Society for Pain Management Nursing, the Coalition Against Pediatric Pain. And then I want to call out that our members work across the life course, right? So I mentioned some of the pediatric organizations that are engaged, and I myself work for the Gerontological Society of America, where our work is around the study of aging. So that aging life course approach, that we are all aging, and we want to be sure that our vision is actually that we all have meaningful lives as we age. So some of our activities and accomplishments, I think the one thing that we're probably most proud of is because we were able to come together as we had back in 2015 and working as a partner with our government agencies, with members of Congress, with other organizations, we were able to see that while the FDA did not put anything in writing that said we are not going to look at acetaminophen with respect to access to anything over 325 milligrams, we were able to see that they wrote in a letter to our coalition around our safe use initiative, right? Safe use of over-the-counter pain relief, that there have been many ongoing efforts in the research area already, and the prevalence of unintended acetaminophen overdose is very low. Now, the reason that the FDA initially wanted to move forward with limiting access is the concern when there's access to medication and people may overdose on that. And as we have continued to educate people, educate the public about how acetaminophen or Tylenol is not only an individual product, it's also in other over-the-counter medications like cough and cold medications. As we started to educate more people about that, we educated the public, we've started to see some of the issues lessen around overdose with acetaminophen. Another thing that we started to work on, since we had established these relationships with colleagues at the FDA and colleagues at the CDC and colleagues at Health and Human Services, was what specifically should we look at with respect to other reasons that access may be limited, or we need more information for the public around access to these medications. So one thing is over-the-counter monograph reform. And what I would say is, so monograph reform, what it really means is a monograph is what's established for any medication, right? And it's sort of like the rule book for a therapeutic class of medication. So take this where we would say analgesics, right? The over-the-counter pain medications. And this establishes the active ingredients, the doses, what needs to be on the label, how the medication is recognized as safe. So we actively worked to increase the FDA's ability to make changes. So prior to 2019, prior to that, if you wanted to make a change on this monographs, you actually needed a really daunting process. So it was very hard to get those changes made. And as part of some of the COVID activities, the CARES Act, which is the Coronavirus Aid, Relief, and Economic Securities Act, when that was passed into law, it changed how the FDA considers new over-the-counter products and those label changes. And it removed some of the burdensome processes that are involved with being able to create that label change. Now, the law has passed, and we continue to monitor for how that could impact us for some of our over-the-counter medications. And that really gets into what's next on my slide about the weight-based pediatric dosing of acetaminophen. And what I would say to you is, how many of you have ever woken up in the middle of the night with a young child under the age of 2, and they seem to have a fever or they're sick, and you go for the over-the-counter acetaminophen, and it says, under the age of 2, call your healthcare professional. Well, at 2 a.m., who can you call, right? So there has long been accepted practices around weight-based pediatric dosing, weight-based dosing for children under the age of 2. It's even gone past some of the FDA advisory committees, and all agree on this. Well, the effects of OTC monograph reform means that now the FDA can take a look at weight-based pediatric dosing so that we could see on the label how you would dose this medication for somebody under the age of 2. And actually, it would be under a certain weight, not under a certain age. And so what I think is really good, and we continue to engage, is to ensure that this monograph actually does get updated for all of us so that the label change can happen. The other thing that you may or may not realize is that while we know that chronic pain is widespread, and it is the leading cause of disability across our nation, data is not systematically collected anywhere on chronic pain prevalence and the related factors, nor is it housed publicly so that researchers, health departments, so that we can all understand the impact of chronic pain. So we have continued to advocate for the Centers for Disease Control and Prevention, or CDC, to have an ability and an authority to collect this data and be able to share this data so that we can actually do the research to find out, really, what does it mean that people have chronic pain and what kind of healthcare costs are associated with that pain management. So we continue to meet with colleagues at the Department of Health and Human Services, the CDC, members of Congress, to advance this type of policy agenda. And one last thing I wanted to raise with you as we're here today, a recent abstract that was published with Pain Management Week, which is a large meeting that specifically looks at different issues in pain management. But this project and research study was done on the role of over-the-counter pain relievers and self-care in America, right? Changing that healthcare landscape. I think over the last few years, we've all had to think about self-care a little bit differently because of our access to different healthcare providers. This was published by an organization, APCO, and really they conducted interviews of a representative U.S. adult population. And here are some of their findings. They found in asking this question of approximately 2,500 patients, it's 2,499 actually, they conducted some surveys. They learned that half of the participants report using over-the-counter medications. Shouldn't be surprised, right? We all use vitamins, pain relievers, different types of over-the-counter medications. But pain relievers were the most commonly reported over-the-counter medicine in participants' homes. Acetaminophen and ibuprofen, Tylenol, Motrin, right, were the analgesics most commonly used. And people reported they used them to manage aches and pains, back pain, arthritis pain, fever. And 73% of those people, that's 3 out of 4 participants, reported using acetaminophen at least a few times over the previous 6 months. Now, I don't want to steal all the thunder of the researchers because we certainly were not the researchers, but I think it's important to know that this kind of research is out there because what this suggests is accessibility and effectiveness of over-the-counter analgesics, acetaminophen, allows individuals to appropriately self-manage their health and quality of life. Now, think about that, how important that is when we know that there was opportunity at some point that it was possible that access to over-the-counter pain relief would be restricted. So again, comes back to the mission and the role of the PAPR coalition. So I just wanted to bring this to your attention. Again, it's always a pleasure to be here. I hope that you'll take a look at our website, paprcoalition.com. It's on the slides. We have some webinars and briefings that are up there that we've conducted over the years around access to pain relief, access to over-the-counter pain medications, including the impact of telehealth on our system and how that has changed and how that will change moving forward. If you have any other questions, please, through our website, send a message to us. If you are part of other organizations or other coalitions that you think should be part of the PAPR coalition, we would invite you to send a message, let us know. One of the webinars that we know will be upcoming in early next year will be related to the study I just referenced. So when that becomes available, we'll be sure to let you know. And with that, I just want to say thank you to colleagues from AAKP. It's a pleasure working with you. It's a fun coalition. And I would just want to say thank you for all of your advocacy work that you do as well as part of AAKP.
Thank you, Patricia. That was a great presentation.